My name is Ed Murray, and I'm the first patient to receive a minimally invasive tricuspid valve replacement at Massachusetts General Hospital. We were in Old Saybrook, Connecticut, and I had trouble walking across the street, which was just a slight incline, walking back to the place we were staying from the beach. Short walk, but for me, it seemed like a long walk because I was having trouble catching my breath. And I went to my primary care doctor, and he told me that we were going to have to find a cardiologist. I already knew somebody, and from my music world, I play the saxophone professionally, and he played trumpet. Most of my friends are musicians, and it's like a brotherhood, I guess. So he put me through a few more tests and diagnosed me with leaky heart valve, tricuspid valve. He said that I was going to need to do something about this because I would continue to go downhill. I had to stop playing music. I just couldn't play anymore due to a lack of wind that's required. So, no wind, no music. I thought if I didn't get any better that I would just have to quit. I would be done with it. Then the next thing I know, he's contacted a friend of his who referred him to Mass General.
Ed is a professional musician, and he plays wind instruments, including the saxophone and several others, and he was not able to do that. And the options at that point were cardiac surgery, which he was evaluated by a cardiac surgeon and, of course, was offered open heart surgery. And the hope was that we could identify a less invasive or transcatheter means by which we could treat his valve disease.
So Dr. Elmaria became my cardiologist at Mass General.
So I met with Ed for a second time in the summer of 2020, and by that point in time, I actually had access to a very new clinical trial, which was designed to test the performance and safety of the Evoke transcatheter heart valve.
It was going to be a tube that was inserted into my lower right groin and went up to the destination, which was my tricuspid valve.
So I educated Ed about the device, the risks, the benefits, and most importantly, actually explained to him that he would be our first. He'd be the first patient that received this technology at Mass General Hospital, and asked him if he was willing to proceed.
Yes, I think I smiled all the way back to Western Massachusetts.
It is the first of its kind technology and something that was very novel and had only been done in a limited fashion around the world. And we were lucky to have it available to us at Mass General and to be able to offer it to Ed.
I'm first at MGH, first one in New England, and the 66th in the country. By the way, I was discharged on August 21st, 2 days.
I just had the pleasure of seeing Ed again for one of his follow-up visits. He is off of all diuretic therapy, he has his energy back, and actually he's signed up for a few gigs, so I absolutely could not be any happier.
My name is Ed Murray, and I was a first patient at Mass General Hospital.